will be up on our YouTube page, which right here. So if you guys need to circle back to any previous meetings, they should be up in there. And I'm going to switch screens and show you a PowerPoint right now. I'm going to try and get to the most important things right up at the top, and then we're going to go through some additional slides just with some data. That's not something we've done really in the past lately, and so I just kind of want to give you a snapshot of what COVID is really like nationwide, here in Arizona, here in Pima County, so you get a little bit of a feel for that. So first things first, again, welcome. And this is super important. So we sent out an email, a big old mass email yesterday. So if this does not sound familiar to you and you need more information, let me know. But hopefully everyone on the call got this information yesterday, which is we're setting up a special vaccination event for next week. I don't know if it's going to be one day or over multiple days because we just need to wait and see how many people are in need of this before we can figure that out. But it'll be next week, where this will just be for educators and childcare providers who want their vaccine and have been struggling and unable to make that first vaccine appointment. So we know this has been a frustrating process. There's a lot of places to register. A lot of people did register and then some never heard anything. And so we're trying to catch some of those people who might have fallen through the cracks and still want to get their vaccine. And if that's you, where you do want your vaccine and you have been unable to make that first appointment, send us the following information: first and last name, date of birth, zip code of your home address, email and phone number, and then you'll be contacted to go and get your first vaccine next week. And where do you send that information? To our new email. So we set up an email just for COVID childcare related questions. HEOC childcare@pima.gov. And this is for any questions, concerns, comments that you have about childcare and COVID. You're welcome to send it to this email. So the reason we did this is because we're just kind of having some staffing changes. For example, this is not my regular job. At some point, I'm going to have to go back to my regular job and someone else will be taking over some of this. And so we just want to make sure that there is a place where you all can ask questions and someone will get back to you. So you know, if you're not having to email people's personal emails in case one of us is no longer doing this work, you can send those things to HEOCchildcare@pima.gov. And just to back up, that is also where you can send this information. So we would like this information. I know it's kind of a quick turnaround, but tomorrow by 10 a.m. Tomorrow by 10 a.m. is the cutoff where we need to send this final list of child care providers and educators who still need to get their first vaccine. So please, if there's anyone that you work with or you yourself that
they
still
keep
would like to
sending
get
out
their
stuff
vaccine,
to
you can do that. If there's multiple folks, so you work at a center that has multiple staff and there's several of you, you can just put this information, you know, in a table where you have everyone's information, whatever you need to do. But this is what we need from you, and we need it if you can send it to this email. So I'm going to stop here really quick just to see if anyone has any questions about this. Okay. And the good news is we did get several email replies back to this request that we put out yesterday saying that their staff have all been vaccinated who want to be, which is great. So we did get a lot of that, which is really positive. But I know there are still a few folks who just have been unable to get their vaccine for whatever reason. So we want to make sure we have this opportunity available to them. So feel free to pass this along if there's anyone that you know that still needs to get theirs. And then again, for this email address, if you have positive cases that you need to report, you can also alert us by sending an email to this email saying we have positive cases we need to report, and we can get back to you that way. And then as always, you can also report on our website. So going to the Back to Schools webpage, clicking that blue button that says Child Care Providers Report a Case, that's still another way to alert us of that as well. But we just wanted to include our new email on here in case you just want to shoot us an email and say, hey, we have positive cases. Or if you just have questions and need guidance, you can send them here as well. So this is just the reporting process that's been slightly updated to now include this email address. Okay. So I'm going to share just some COVID data with you all just to give you an idea of where we're at. So Arizona, we're over 800,000 confirmed and probable cases with around a little over 15,500 deaths. So nationally, you can see the data from CDC of what we're looking at nationally. You've probably heard on the news that we did go over that 500,000 total death mark nationwide, which is incredibly unfortunate and just happens to be where we are. So I just wanted to give you an idea of where Arizona stands kind of with the rest of the nation. Again, COVID-19 in Arizona, this gives you a better idea of who has been experiencing COVID by age group. The 20 to 44 year age you can see is by far the age group that's experienced more COVID cases than any others. But then on the flip side, COVID deaths by age group, the 65-year and older group has been vastly disproportionately affected when it comes to deaths, which is why we were prioritizing older individuals for the vaccine as much as we were. So I know that was kind of frustrating as well in terms of having to sort of set aside certain sites that were just for older adults, and I know it created challenges for you all to get appointments, but we really wanted to make sure that those folks got vaccinated first because you can see, unfortunately, they were dying more than everybody else. We also have on here COVID cases by race, ethnicity, and also deaths by race and ethnicity. White, non-Hispanic, and Hispanic or Latino are responsible for most of the cases and also the deaths. Okay, and then again, COVID-19, this is just here in Pima County, 108,630 cases in Pima County, 2,180 deaths. This big spike was throughout December and January. As we know, we were experiencing really high transmission during that time, and thankfully things have started to come down pretty significantly in the last few weeks, which is good news, but does not mean that we can relax some of our mitigation efforts. And so, you know, that's something that we really want to keep pushing, is that we're continuing to wear masks, wash hands, social distance, and doing all the things that I know you all are doing in your facilities and in your homes, because we want to keep this trend on the downward. And we've seen before over the summer where we had that peak and things came down, and they obviously went way, way back up again over the holidays. So we hopefully we can avoid that this time around. Again, this graph looks a lot like the last one. This is Pima County deaths. These big spikes mirror the big spikes we had around COVID cases around the same time through December, January, and have been coming down in recent months. You can see the deaths are more males than females, but split relatively evenly. Again, just for more information, positive admissions, this is by week. Again, this big peak here was in the last couple of months. More information on ICU bed usage. Basically, a lot of the ICU beds were being utilized by COVID patients, and that's something that we were seeing nationwide. Just a lot of folks in the hospital requiring ICU care, unfortunately. Some more information on long-term care assisted living. This might not be relevant to you, but we just like to share this information for transparency and to keep you all up to date. So again, more deaths in long-term care facilities in those months towards the end of 2020, just sort of on par with the other graphs and data that we've been seeing. Testing. So this just shows you all of the people that were tested and when they were tested. Again, we had more testing throughout this time over the holidays where we had a lot more cases. I'm not going to go into too much depth onto this. You guys will have the slides if you want to know more about testing and who was getting tested and where and how old they were, all those kinds of things. You can look into that. So this is something that I know has been in the news quite a bit lately, and this might be of interest to you all, is there are several new COVID variants, which I know could be a little bit concerning because we're not sure, you know, whether the vaccine is going to be able to address all of the new and emerging variants and those kinds of things. But this is just to give you an idea of how many COVID cases in Arizona are of the new COVID variety. And you can see the B117, that's the UK variant that was been really prevalent in the United Kingdom. 6 cases of that variant have been found in Arizona and none of the other 2 right now. So just to sort of maybe put into perspective some things that you might have been seeing on the news, there have only been 6 cases of the UK variant and the other 2 no. So you can see how that compares to the number of cases reported across the U.S. That variant, under 2,000 have been found in the U.S. total. But unfortunately, those numbers will likely increase if I had to guess, but for now, that's where we're at. So what we know, that there are multiple COVID variants that are circulating. This B117, as I mentioned, in the UK has emerged with a large number of mutations. We do know that it spreads more effectively and quickly, but there's no evidence that shows that this variant causes more severe illness or increased risk of death. So we just know that it's being transmitted more easily, but is not causing more death. Again, to reiterate, 6 of those variants have been identified in Arizona. The South Africa variant, 22 cases have been reported in 10 states, and the variant from Brazil, 4 states have reported a total of 5 cases. So this does not represent all possible cases. These are just the ones that have been reported through the surveillance systems that are in place. So that's just what we know. What we don't know how widely these new variants have spread, as I just mentioned, and we don't know how the disease caused by these new variants differs from the disease caused by other variants. And lastly, we're not sure how these may affect existing therapies, vaccines, and tests. So like all things COVID, we just don't know enough until it's been around long enough for us to be able to collect data and figure out what's going on. So hopefully these bullet points on things we don't know will soon become things we do know. But until then, hopefully, maybe this just gave you a little bit of perspective of where we're at. Okay, so Rachel on our last call brought up a really great question about pre-employment screening for TB and how that plays into the COVID vaccine. So a little bit of context here. The Bureau of Childcare Licensing through Arizona Department of Health Services states that a licensee shall ensure that a staff member or volunteer submits on or before the starting date of employment evidence that they're free from active TB, meaning they need to get a TB test before they start employment if they're working for a licensed child care provider through Arizona Department of Health Services. This is from the CDC, which states that the 2 vaccines that this does not include Johnson & Johnson, which just got approved. So for Moderna and Pfizer, those vaccines do not expect to result in a false positive on your TB test. The TB test is not expected to alter the safety or effectiveness of the vaccine, and whether or not the vaccine could cause a false negative result for TB test was not tested. So basically we know that the Moderna and Pfizer vaccines do not cause false positive TB tests, but no testing has been done to determine if the vaccines could cause a false negative. So basically, getting a TB test is totally fine if you are planning to or have gotten your COVID test. A little bit of additional information here. The COVID vaccine should not be delayed because of the screening for TB, and the TB screening can be done before or at the same time as the Moderna or Pfizer vaccine, or it can be deferred until at least 4 weeks after completion of the COVID vaccine process. So if for some reason you're not able to get your TB test before you get your COVID vaccine or at the same time as your COVID vaccine, you can wait 4 weeks until after your second vaccine. So once you've completed the full series, which is 2 shots for Moderna or Pfizer, 4 weeks after that, you can get your TB test if for some reason you weren't able to get your TB test before or at the same time as your COVID vaccine. So, what we would suggest is, if possible, to get your TB test, if you know when your COVID test is coming up, get your TB test before that. Okay, so again, this is from Arizona Department of Health Services, Bureau of Child Care Licensing, and we did speak with Lisa Emery and Julie Mendeville from ADHS. We did confirm this information with them, so just know that, we didn't just make this up. But this was their temporary accommodation that they are sharing, which is a copy of the staff person's vaccination record should be kept in their file to serve as an explanation as to why staff started without pre-employment TB screening. So if they did defer their TB screening for those 4 weeks, keep a copy of the staff person's vaccination record so you can show that. So I mentioned again, staff will have 4 weeks from their second dose to get their TB test and submit the TB screening results. And what's super important here is ADHS will not issue a citation if an individual does not have their TB test done and is in the vaccine window. So if it's within those 4 weeks, they haven't gotten their TB test yet, that's no problem. They've got 4 weeks to do it. But if the surveyor comes back after the 4-week window, so 5 or 6 weeks after the person started, then the individual has still not gotten their TB test, they could result in a citation. So basically, they've got 4 weeks after their second dose to get their TB test, and if they haven't done that, then they could be cited from ADHS. So TB tests definitely still need to happen for new employees. Per ADHS, they still have to get their TB test, but it can be deferred for 4 weeks after their second dose. Anything longer than 4 weeks after their second dose, and they're susceptible to getting cited. So I'm going to stop there and see if there's any questions about that. I'm hoping I was mostly clear, but this isn't my sort of general purview. So any questions about TB tests and how that plays into new employment things and licensing and all that jazz? Okay, and then the other thing that I think I forgot to mention, again, is this is guidance specifically from ADHS and the Bureau of Child Care Licensing. So if you are licensed through DES, you'll need to speak with DES to determine if there's anything similar that they've put out around TB testing. But if you're licensed through ADHS, then you've got 4 weeks after your second dose to get that TB test. And the other option is just get your TB test before your COVID vaccine or at the same time. Diane, did I miss anything?
I'm sorry, I got called away right as you were presenting that, but I think from what I could hear,
no
you
worries.
pretty much covered everything.
Okay, I think I got it all.
Yeah, I think so too. And so it's really if you're doing the hiring process and you're hiring someone who's already started their vaccination process, then there's an accommodation being made so that you can start them. And so thank you for presenting that.
Of course. Thank you, Diane. Okay, and then, yeah, just a few other pieces of additional guidance that I mentioned, which is work with new hires to get their TB test done prior to vaccination if possible. If not, make sure your licensing surveyor is aware of the situation and follow guidance on the previous slide. And then, yes, again, this is just for Pfizer and Moderna. We don't have an answer yet for Johnson & Johnson. And as always, this guidance could change at any time. So work with your licensing surveyor if you have additional questions. We're just trying to share this information that we got from ADHS with all of you in case for some reason, you haven't heard this information or you're not in contact with them regularly. But if you have more specific questions about this, reach out to your licensing surveyor. Okay, and then the last thing I wanted to share, does anybody need bleach? We have a lot of bleach. And so if you need bleach at your facility, send me an email or send it to the HEOC childcare@puma.gov. The childcare@puma.gov email, I think I'm going to keep pushing that email as the best place to get any questions answered about COVID. At some point, I don't know when, as I mentioned, I will no longer be serving in this role at some point. So if you need bleach, send us an email and let us know. If you happen to know how much you need, that's even better. Quantities, tell us how much you need, and we can get you bleach. Okay, that was everything I had for today. So does anybody have any questions about either anything I mentioned or just any COVID stuff in general that has come up in the last 2 weeks? No? Okay, I'm gonna hang on. I'll hang on the call for another, I don't know, 10 minutes or so if anyone has anything. Otherwise, I think I just bought you guys back an extra 40 minutes of your day. As always, if anything comes up between now and our next call, reach out to us, heocchildcare@pima.gov. If you have my phone number, give me a call, whatever you need, we're around. And yeah, if you don't have anything else, other questions, you're welcome to jump off. I'll stick around for another 10 minutes. Thanks, everybody. Have a great day.
I actually had a question.
Sure, go ahead.
Okay, a while back, I had received a listing